So I'm going to take you on a little video tour of my office and what exactly we do in a medical office to stop the spread of coronavirus. This is going to be really important once people start coming back. When you come to our offices, we have the official instructions for what you're going to do when you come to our offices. Remember, in Contra Costa County, everyone is required to put that sign on the door and to provide all of the things that people need in order to work in your office. But the first thing you're going to see when you get in here is more wipes and hand sanitizer. As a matter of fact, you probably can't move more than 10 or 15 steps in my office without reaching some hand sanitizer. But here's what you need to know. This is the social distancing protocol. So here's our office protocol for how we're going to work when we start seeing more than one patient at a time. And then here's the other thing that you need to know. This is the order of the Contra Costa Health Services Health Officer. So this is how we get our information on how we need to operate in order to stop the spread of coronavirus. This is where we would normally have a staff member, but because we can't do social distancing at this particular location right by the door, this is where we actually go. Come on through and look over here. So this window right here with more hand sanitizer is where you're going to be able to make new appointments, talk to somebody, pay your bill, schedule anything else that you need. And then this is where we're keeping everybody apart. You can see that everything has been measured out for 6 feet apart. And here's the other thing that you should know. So I'm gonna start back here, and we're gonna count steps until we hit our next hand sanitizer. Backward steps. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And here it is. The next, oh, I'm going backwards. The next hand sanitizer station. This one has to be Purell. The other one was Clorox, but they all work. So within that 10 steps, there's actually also 2 more sinks that we are required to have open for our staff, but also are available for our patients to wash their hands. And I'll show you where all the personal protective equipment is. This is where we keep our personal protective equipment. You can see we have enough for ourselves and for our patients. We are not hoarding. And shame on you if you are hoarding. And here's our yellow gowns. This is what we're going to be wearing to protect ourselves and keep you from getting sick. None of our staff are sick. Everyone has been obeying the order to just stay at home, keep themselves completely isolated from friends and family. It's always difficult, but you know what? We take our responsibility towards our patients very seriously. How do we sterilize everything in between? That guy right there. We actually nicknamed this little guy. We got him about 15 years ago. The nickname is, I don't know if you can see it. The nickname is, can you see that there? Sven, because he's made by a company in one of those Northern European countries. So Sven sounded like a really good name. But Sven is what keeps us on task. Sven sterilizes all our equipment. We can sterilize pretty much anything in Sven, and Sven is working pretty much around the clock. As a matter of fact, Sven is still on. It's okay, Sven, we'll give you a break. And there's a sink here with the eye wash station. Right before COVID-19 came to the shores of the United States, we actually had our Sara Wasserbauer MD yearly update with HIPAA and OSHA guidelines to keep everybody safe and retrain everybody. We do this every single year. It's part of our legal obligations, but it's also part of our obligation to our patients that we enjoy. So that is the end of the tour of the Sara Wasserbauer MD offices. Now, when we start to come back from COVID-19, you will be visiting our offices. And I just want people to know you will be safe. We still take care of our patients. We're still seeing some patients who need to be seen. We're not abandoning our patients who have surgical needs at this time. And we're gonna be taking care of patients when this all gets better. And you need to know that when we start to take care of patients again, we will all be doing it in a safe and effective manner. We'll see you all soon.